I'm really sorry to tell you, but your husband has a large malignant brain tumor, and I'm here to escort you to the emergency room. He needs surgery immediately. And his diagnosis was glioblastoma, which is grade 4 brain tumor. It is considered the deadliest form of cancer that there is. Average survival is 12 to 14 months from the time of diagnosis. The problem with glioblastoma is even when you remove all visible tumor, there are a lot of kind of microscopic cells hanging around, and those are the ones that cause problems later on. We have decided that we will go anywhere, do anything. I mean, we knew right away that we wanted to think as far out of the box as we possibly could. We think that standard of care is suboptimal. We know there are treatments out there. We would be willing to go anywhere and try anything if it could possibly help him. Store My Tumor has played a pretty major role in David's care because we learned pretty fast the importance of storing tumor that's removed carefully and correctly, because we didn't do it the first time, and it closed a lot of doors for us. One of the first things that I knew I was going to do was to get in touch with Store My Tumor and make sure that his sample was stored in a way that kept as many options open to us and left as many doors open as possible in terms of present and future treatment. We immediately got in touch with the Store My Tumor folks, connected them with the neurosurgeon and the neuro-oncologist who were on board. Felt like I was talking to a friend. I was talking to a friend who had our best interest in mind. We arranged to have the tumor sample that was removed stored in as many different ways as possible to make sure that our options were not limited. We ended up using the sample to get chemosensitivity testing on it, which has been really helpful. Our only regret is that if we had known how helpful it would be, we would have given a bigger sample so that we could have tested even more of it. And then we also used it to create some personalized treatments and to work with teams overseas who are doing really innovative work to help patients in David's situation. And it's been very helpful. We incorporated information from that report into his treatment right away. I think that as opposed to feeling like we're just shooting in the dark, I think at least we feel like we have a bit of a target. As they say, the rest is history. We kind of got on this roller coaster and we've been on it ever since. And that was almost 17 months ago. We have tons and tons to fight for. He has so much to live for.